it was not 0.5, it was 2.5. Sorry for the error there. ALD, the assessment of language development. If you see the item analysis that I have put for her, it talks. If you can you see the ones in red that I have talked about? Like what part of the anatomy of the language that I'm testing when I'm doing ALD, when I'm doing PLS5, and even the COMDL, right? So most of it actually is coming to the semantics. Are you all able to see this?
Yes,
Yeah.
yes, yes, yes.
Yeah, yeah. So the first one, the ALD says that understands spatial concept, like we just spoke about it, that it doesn't go in syntax, it actually goes in semantics, whether the child has the spatial concepts, which is like in and out, and then understand some pronouns, the pragmatics here actually. See, again, if you use the pronouns, it becomes a pragmatic. Like, for example, if I say that Sita is a girl, and then in the next sentence, I'm expected to use that she is a good dancer. If I keep saying Sita is a girl, Sita is a good dancer, Sita goes to school, Sita has this, that means I'm not really talking, I'm not using the rules of that language. When I say that she means it's a pragmatic indicator that I know and that I also let you know that whom that she we are talking about is. So actually, if you see further down, it becomes into goes into the pragmatic form. Knows about 50 words, goes in semantics, uses the question inflection, goes in pragmatics, combines 2 to 3 words, spontaneous speech. Though it is syntax here, and I put two asterisks, it actually to connect or give me more information. So if the child says that the I'm now using the English examples out here. If I say लड़के ने चॉकलेट लड़का चॉकलेट खाता है और if I just say कि लड़का खाता है chocolate. Okay, so if I change the kind of the word order, I'm still able to use and pass the criteria that I'm using 2 or 3 words to combine into a sentence, irrespective of what I'm saying is whether I'm using the right syntax of that particular thing. If I say in English, the boy eats chocolates, but if I just say chocolates, boy eat. Okay, so I'm still combining 2 to 3 words to make a sentence, and I'm not just saying chocolate, chocolate, boy, boy. Okay, so I still pass the criteria that I'm using 2 to 3 words to combine it in a sentence, though it is not syntactically correct sentence. Okay, but I pass the criteria. Names, pictures, uses plural, says about 40 words, again goes into the semantic category. So if I see between the age of 2 to 2.5 years, if I actually perform the ALD, I'm checking more of the semantics of that particular language rather than seeing any other aspect of language, right? I haven't spoken about the phonology, the morphology, or even the syntax for that matter, right?
To
If
check
I
the
go,
syntax all the time, like we said, we can have a very informal setup that just the animals are kept on the table with some boxes or with some beakers or with some spoon, and are we going to put the animals in the beaker and stir them, and then okay, here is this one, here is this one for you, can be a basic language activity, and see how the child is using the rules of the particular language that is coming up. Now, modeling, prompting, recasting, sentence building, we have all read about it, but are we doing it with the intention that we want to work on a particular characteristics of that particular language? That this, if I could write my intervention goal, is that the child's syntactical knowledge today is only, just using inappropriate. Or typical or the regular past tenses. In the next 3 months, am I able to take this child to the category of is able to even use irregular past tense? Is how specific my intervention goals have to be put to in the report and put even to the parents. Then alone I can work on these kind of the subtle language development that I'm talking about. That okay, this is what I've identified. The child is expected to do this, but not doing it as far as the standard criterion. And now I'm going to put it into intervention. That the child will start using gender markers. The child will start using tense markers in the next 3 months or 6 months, depends on where the we start. So this is the sample pro forma that Asha has given, which is available on the website. The case history, the observation, and here is the more important thing that I've highlighted is the language sample analysis, which is so extremely important, which most of us miss out. Most of us, when I say it's including me as well. And here it is the mean length of utterance and the TTR also. The TTR was a vocabulary which I got was introduced a little later after my post graduation actually is the type and the token. So suppose if I say that sentence has the cat sat on the mat has six kind of the tokens. How many words are present is the six. The cat sat on the mat. Six. But the word the has been used twice. So it reduces it to only five. So I will count the only once. So more than just the MLU, the TTR is of more importance. So I will just read out to you. Am I making it clear, the TTR? So for that, we need to kind of,
Yes, yes.
the transcription verbally, doing the
Mm,
verbatim recording and writing it down, like Aradhana said that she does that. Writing, even if the child says ha, you write ha.
mm,
Nahi, write a nahi, and then you would get it. So in the word like the cat sat on the mat, it has six tokens, but the types are only five because the is used twice.
mm.
So the TTR comes to 5 upon 6, that is 0.83, which needs to happen. Are we doing that? And then the assessment highlight the strengths. Our report needs to go with the strengths, highlight the areas when the patient has demonstrated the language skill, that the zone of proximity, the ZPD, okay, and the areas of concern about the receptive language, the expressive language, the pragmatics, and then comes the diagnosis, then what are the recommendations and collaboration. And very importantly, the functional impact is something that we need to mention on the report. So I know it is a little diversion from that morphosyntax that we spoke about. The morphosyntax was brought for the TTR, but there has to be some mention of the functional capacity of the child also. And key points to consider: the cultural and linguistic appropriate assessment, like we were discussing for so far, that if I'm testing a child using Tamil as a primary language, I may not be the right person if Tamil is not my background.